Hi guys, my name's Sam Corton. I'm a sports therapist here in the UK. I have an opportunity over this video to help you identify and in some cases relax traumaed muscles in the shoulder, neck and upper back. Hope it helps. Here we go. So for this video you will need a tennis ball and if you have one, a roller. There can be other things that we can use, but these two items really give you a really good result. So we've got the tennis ball or something similar, but it needs to have a particular resistance to it, not something that you just lie on and it just crumbles underneath you. All right, or then the roller. So this is my roller. It's hard polystyrene. You may have various types, but a roller will do the job. This morning's scenario, I led an outdoor class and I slipped on wet grass. Although I got back up on my feet very quickly, there was a certain degree of reaction. All happened down on the left side. As I went down, the left hand came into contact and I had an indirect ricocheted from the hand all the way up into the neck. The reason why I want to take this opportunity is because it's happening to me right now and I can then work through a particular plan and I know it will get key muscles. Very importantly, if you have any issues with regards an injury, if you have any issues with regards to high levels of pain, then if you have a practitioner that you are comfortable going to, if you've been to see your doctor, if you are under an umbrella of care, then please prioritise what has been said to you. This video is just an opportunity to help if I can. So the first thing that I need to do is where do I feel it and kind of what level of pain is it? 0 being nothing and 10 being absolutely hold your breath pain. So for me, it is a mild irritants to me. I would say it's probably in the 4 and 5s. I can feel a bit of a throbbing going on in the back here. So in this muscle particularly, which is my trapezius. So as my hand hit the ground, it would have come up like that and it's gone into shock. So the trapezius is particularly irritated. I also know from experience that I overstrained in here as well, and there are a couple of muscles in here, teres major and minor, and if they become irritated, they can really hold on. And you can get your shoulder looked at by anybody professional, or if you are particularly happy with yourself doing it, if you don't get these particular muscles, a shoulder can stay irritated for a lot longer. The other area that I'd like you to also focus on is the front. So as my arm went down, the muscle in my chest wall, pec minor, would have got also stimulated and possibly into shock. So this is another area that we're going to have a look at. And finally, rhomboids. The rhomboid muscle is situated in between the shoulder blade and the spine, and you have an upper and lower. All these muscles and some possible others can all become irritated. And it is my job now, for me personally, to try and undo those irritated muscles, which just helps them heal quicker and gets them to connect that they are okay. So the first thing we're going to do is I'm going to use the roller. I'm going to adjust the camera as I go to give us an opportunity to give us a better sight. So firstly, I'm going to bring the camera down to the level of the mat. I've got my roller. I bring it in and I'm going to just check if I've got any tightness or irritation generally in my upper back. Now I am more connected to these muscles than most, and I'm going to try and make it as clear as possible to you about what I'm doing and what I'm feeling. So I know that the irritation is on my left side. And I'm firstly going to bring you to the attention of teres minor and major, which are situated on the outside of the shoulder blade towards your armpit. This muscle allows you to extend and pull back. And it is in fact this action that I'm doing right now that is getting those muscles. And I can tell you now that my general discomfort, although was around the 4 and 5, these muscles are kicking up to the 7s, okay, and 8s. They are very important muscles to the shoulder there. As I've extended and I've applied the pressure to those particular muscles, I am causing an external stressor. I have to focus my breath and I'm just exploring the range and the reaction. But my brain is getting those messages that I'm okay, that I have recognized those muscles have been placed in trauma, and my actions are trying to get them to calm down. I am creating pressure to the knot and getting it to disperse back out amongst the muscle fibers. This is my first area of focus. From here, I'm going to do a couple more, and if you find that the initial pain, or feedback I like to call it, has dissipated, then I search to see if I can find it anywhere else in that muscle area. And I have. Just by that little adjustment there, I have moved it to another area. I'm now changing the movement of my arm, and I'm trying to reenact the movement that would have occurred when I slipped on the wet grass and took the impact on the left side of my torso. Deep breathing and telling the brain that I'm okay. From here, I'm going to gently come off. Now the partner to that area is the chest wall. So what I'm going to do now is I'm going to turn over, stay in camera shot, and come down now on pec minor, the chest wall. As I apply that pressure into the chest, I extend the arm and I bring it back. So I'm reenacting the movement, and I'm also engaging the function of said muscle. So pec minor is a muscle that allows your arm to go up and extend, and it's the muscle that pulls the arm down. You may feel the top of your shoulder, which is your deltoid. If you've had an injury or an issue for a long period of time, the deltoid would have become rather weak and it would become rather guarded because you don't want to irritate what's going on. So I've gone from teres minor and major in the back near the armpit. Now I've come to pec minor, and I'm just exploring what I can feel and if there's any resistance. Depending on how you're feeling, depends on how much pressure you put on. So there, I have found the muscle in the side of my chest and it feels particularly tender. Now I'm not spending any more than 2 minutes on each major muscle group. And the reason why I'm not is because I don't want to cause any extra inflammation, and I don't want to tire out any particular muscle group. So again, telling the brain that it's been recognised and that it's okay. From here, we are now going to move back to the rhomboid area. Now you can use a roller, a larger surface area, okay, is kinder to the area. Now I know myself rather well, so I'm going to go to a tennis ball. So I take the roller out, I take the tennis ball and I locate it in between the shoulder blade and my spine. Once again, I cannot say enough that I am rather connected to these muscles, and as a practitioner, as a sports masseur, I obviously use my skills on a day-to-day basis. And this is why I feel comfortable and confident about sharing this knowledge with you. And if it helps, then fantastic. So now I've got that tennis ball in my shoulder blade. Stomach is in, spine is neutral, and my head is rested. Now you might find, again, if this has happened in the last 24 or 48 hours, I must ask you to be careful. But if it's been happening for a long time and you've just not been to see anybody, you are going to have trauma and guarding. So you need to focus your breathing. As I breathe in, I feel the intensity build. As I exhale, it lessens. And this is another way of self-massage. There are also 3 ways that the rhomboid works. Basic. The arm comes down to the ground. I breathe in and I breathe out and I come down. You may find that you don't have full range. You may only be able to come up here and it's too painful. Please don't fight that. Go to the point you can and come back. I'm going to ask 3 or 4 times. Each time you might find you go a little further. Good. Apologise about crossing my face, but we are now going to change the direction of our arm. So this time, guys, we're going to come out like a wing, and then we come down the centre of the body. These 3 different movements may give you 3 different types of sensation, some being slightly more than the other. I need you to take it easy, breathe easy, and in some cases you might have to move the tennis ball somewhere else. It's like tracking air under wallpaper, moving it around. If you have found a particularly painful area and it is too painful to operate, then I want you to move the tennis ball or the roller slightly off, and it gives you an opportunity to get your breathing right and the movement. Last action is it comes out like a wing, it comes up over the top, and you try and tap the floor on the other side. This opens up the scapula, it opens up the shoulder, and I'm starting to get a bit of clicking, which is where the muscles are relaxing and the joint is able to be free. So again, 3 or 4 times. Now the pain may very well intensify as you are doing this. This is very normal, but I don't want you to push it to level 10. If the pain starts creeping up, then you are to stop, take the tennis ball or the roller out, and just let everything breathe, and do the movements without the pressure. You may very well find that the movement has improved. So as I've been talking to you, I have left the tennis ball in there. But now I'm going to take the ball out. And as I said, I'm now going to take the arm up and over. I can breathe easier. I feel like I can inflate and expand my rib cage. From here, I come through the wing and then down. Good. And then again, I come over the top and come over. Now this may be a good opportunity to actually turn this into a stretch, which gets into the deltoid and gets into the rhomboid, which is the back of the shoulder, and allows me to breathe. Also from here, My left arm is the affected arm. So what I can do is take this to the ground. If I move away from the camera, I straighten my legs, and then I do an indirect stretch of the chest wall. Bring the leg away and open up the chest. I come back and I go one more time. And then I relax. Now, there are two other areas that we have not touched, and I'm going to just discuss them now. As I said, trapezius is another muscle that is prone to be irritated if you get some sort of shoulder whiplash. That is the big muscle on the very top of the back, the shoulder. As I'm pushing into it, I can feel a knot. As I am neutral, I place my hand into said knot and I can move my head away from the shoulder. Coming away, stretching, coming out. I also can work the movement of my arm. I've applied pressure. You may find, due to upper body strength, that this is something that you struggle with. If you have somebody you trust to apply pressure in there while you do this movement, that's absolutely fantastic. My last choice would be to use an object that would apply pressure down into the top of the shoulder, and for you to then move your arm through the range of motion. What would that object look like? It could be a broom handle, applying pressure in there. It could be a rolling pin. We basically need something of a particularly sturdy nature that can apply pressure down into the muscle. But this will never be a replacement of going to see a professional. Somebody who knows what the muscles are doing and somebody who knows how to apply the correct pressure to these muscles. Lastly, guys, is the muscle that's in front of trapezius, and this is levator scapular. This is the muscle deep in the neck that attaches up to the skull and down into the shoulder. And guys, if your head ever feels heavy, if you ever feel that you can't quite get your head upright, then it's going to be a partnership of trapezius, levator scapula, and pectoral minor. These muscles work together in harmony, and if any of them go out of sync, then you are going to have these restrictions. So I've applied pressure to all of these muscles and they have told me how angry they are. It is very unlikely that if you have a muscle that is at 8, that you are going to get it down to a 3 in one go. It is more likely you'll get it to go down by 2 numbers of feedback, and it will creep back up by 1 the next time you do it. I would advise that try and do it every 24 hours whilst the pain and the injury is there. And if it is too painful to interact with, then leave it for another 12 hours, let everything calm down, and then go again. Finally, stretch. We must remind the muscles of their range. So as I lie here now, my arm that is down is going to be palm up. I apply my hand to my head and I open up those muscles. I breathe and I stretch. 15 to 20 seconds if it's not too painful. I relax the neck and then I take the arm up and I go again. And I repeat this 3 times on each up and downward motion. Breathe, stretch and relax. So you're going to do that twice more in the down position and in the up position. Lastly, I'm going to move into child's pose with extended arms. So I'm going to turn over, and reminder that if you are particularly tight or you are tightly traumatized, then please give yourself time and go and see somebody. So this is another good stretch for the areas around the armpits, okay? So we're going through the stretch, and all I'm going to ask you to do is to bring the thumbs up and place them down. Now I can really feel this on my left side, and of course that would be because that's the side I went down on. And then lastly, I'm going to come up, through, back and relax. Up, through, back and relax. Last one. So what I'd like to finish on is thanking you for joining me on this short shoulder and neck tutorial. In the last few minutes, I have felt things click, dunk, which is kind of the noise internally that I can hear things happening. And I can't say enough that I am a practitioner. I know what good behaviour and what compensation behaviour feels like. I feel that the number that is radiating around my shoulder has gone down. I'm going to keep my hydration on point today, because that can have a huge effect on tissue behaviour, health. It is the way that our nerves and our impulses are transmitted. And I'm not going to do any crazy lifting, and I'm going to be mindful of my posture, trying to keep mildly moving and not trying to stay in the same position for too long. I'm very aware that as I'm lying on my side here, that I am pushing pressure in the top of my neck and my shoulder, but I also don't want to be fearful of what I'm feeling. If this has been helpful for you, please give us a like, subscribe. I will be doing more videos, and if you would like to give me a suggestion on anything else to cover, please do in the comments below. My name's Sam, I'm a sports therapist, and I'm based in the UK. Speak to you soon, take care, bye for now.